My name is Eddie Morris and I'm Vice President for Clinical Quality at the Royal College of Obstetricians and Gynaecologists. And I'm here today to talk about the inclusion of hysterectomy for heavy menstrual bleeding as part of the NHS Evidence-Based Interventions Programme. Heavy menstrual bleeding or menorrhagia is a term we use to define abnormal periods such that a woman may bleed very heavily or have prolonged, drawn-out periods. It becomes a problem when a woman says that it's affecting the quality of her life and seeks treatment for it. If there are no underlying causes for a woman's heavy menstrual bleeding, there are often some very simple treatments that can be used to treat it, such as the oral contraceptive pill or other medications that can reduce the amount of bleeding that happens during her period. One of the most significant recent developments in the treatment of heavy menstrual bleeding has been the use of the intrauterine system, where a device fitted in a similar fashion to that of a coil is inserted into the womb, and this releases a very low dose of the hormone similar to that which is in the mini pill, and this reduces the amount of bleeding significantly whilst offering a good contraceptive effect. One of the significant advantages of the intrauterine system is it can be easily fitted in clinic by doctors or nurses. Whilst many hysterectomies can be performed by keyhole surgery, it's important for the patient to remember that she has actually had a major operation, and this may well need a longer recovery time and can also be accompanied by potential risks and complications. Research has also shown that if a woman has a hysterectomy and wishes to keep her ovaries, it is still associated with a slightly earlier menopause than might otherwise have happened. Myself and my colleagues at the Royal College of Obstetricians and Gynaecologists strongly support the inclusion of hysterectomy for heavy menstrual bleeding in the NHS EBI programme. This is a way to reduce surgical risk to patients and concentrate the resources where they are needed the most.